I'm Samantha and I'm a nurse practitioner student at Boise State University, and I'm going to be doing a health assessment. This is Riley and he's here for his general wellness exam. When I first entered the room, I would be washing my hands and introducing myself. I would then review his vital signs, including temperature, pulse, blood pressure, respirations, pulse oximetry, height, weight, and body mass index. I would also take a general survey of him. In this case, I would be looking at his nutrition status. He looks to be in good nutrition. He's making good eye contact. He appears to be of judgment sound. He looks groomed and well kept. We would then move on to the skin assessment. First, I'm going to take a look at your nails. Capillary refill is less than 3 seconds. No clubbing is noted. His skin feels dry, warm, and it's normal color for his ethnicity. I'm then going to look at his head. His facial features look symmetrical. I'm just going to feel around on his scalp. No lesions are noted. Any tenderness?
No.
And then we're going to take a look at his ears. Any tenderness here?
Nope.
There's no discharge noted. They're intact. They're symmetrical. If I had an otoscope, I would look in his ears, look at his tympanic membrane, and note any discharge. I'm also going to check your hearing with a whisper test. So I'm going to cover this ear, and I'm going to whisper something to you, and I just want you to repeat it back to me.
Apple.
And this side? Orange.
Orange.
Perfect. Then we're going to go to your eyes next. I'm going to shine a big bright light in them. Look right at me. Excellent. I'm looking at the appearance of his eyebrows, his eyelids, and then the sclera of his eyes. His eyes look moist and intact. I want you to follow my finger with your eyes. Perfect. I would use my ophthalmoscope and I would look at his retinal vessels. I'm then also going to have you cover your right eye for me. Perfect. And then I want you to tell me how many fingers am I holding up?
1, 2, 1, 3.
Perfect. We're going to do the same thing with the other eye. So cover your left eye with your left hand for me. And how many fingers am I holding up? Look right at me.
2, 1, 3, 1.
Perfect. And then you can remove your hand. I'm going to look at your nose, and his nose appears symmetrical. I would use my ophthalmoscope and I would look in his nasal canal, and I would look at his septum to see if that is occluded. I would also be looking for discharge. Now we're going to be looking at his mouth. If you want to open your mouth for me. And I'm just looking for dental caries, erythema, or edema. I don't appear to see any of those. If you want to stick out your tongue for me and move it to the right and to the left and say I just want to look at the back of your throat. Perfect. Uvula doesn't appear to be edematous, and the tonsils don't appear edematous or arrhythmic. I'm also going to be palpating your sinuses. I'm going to first do these by your nose. Any tenderness?
Nope.
And then up by your eyebrows. Any tenderness?
Nope.
And then I'm just going to palpate your temporal arteries here. And they're 2+, which is excellent. And then if you want to give me a big smile and puff out your cheeks. Perfect. And no facial droop is noted. So then we'll be moving on to the neck. So I'm going to start by palpating his cervical spine. I'm just going to feel up the back of your neck. Any tenderness?
Nope.
And I'm going to feel your muscles up here and muscles down by your neck. Any tenderness?
Nope.
Perfect. And I'm going to have you look left and look right and touch your chin to your chest and back the opposite way. Perfect. And then I want you to bend your neck by touching your ear to your shoulder and the opposite way. Perfect. 5 out of 5 strength. He doesn't appear to have any rigidity or tenderness when he does that. I'm going to look at his trachea, and if you want to look up for me, his trachea appears midline. And then I'm going to be palpating for your lymph nodes. So I'm going to be under your chin here, and back behind your head, and by your ears, and then down by your clavicles here, and then down by your armpits. Excellent. And then we're going to walk around the back and we're going to palpate his thyroid from behind. And I want you to look up for me. I'm just going to be feeling for your thyroid here. And can you give me a swallow? Perfect. And no nodules are noted. Perfect. We're then going to move on to the chest. When first starting with the chest, we want to first just inspect it. He doesn't appear to be in any distress. He's not using any accessory muscles. As he takes a big deep breath, it all looks equal and symmetrical. So we're first going to start with palpating, and we're going to do tactile fremitus. We're going to start from the back side, so if you want to move your legs over to the left there for me. Perfect. And I just want you to repeat 99 for me. So start.
99.
And again.
99.
And again.
99.
Perfect. And then face me again. And we're going to do the same thing from the front side. So go ahead.
99.
And again.
99.
And again.
99.
Perfect. And then we're going to percuss. So I'm going to start up here, and we'll do each lobe of his lung. And we're just looking for any dullness. And we're going to come around the back side, so if you want to flip your legs over to the left there again for me. And he's resonant throughout, both anterior and posterior. Now we're going to take a listen. So you can just breathe in like normal for me, and I'm going to listen to the front side of you. And if you want to flip around left for me, so I can listen to the back side of you. Perfect, and I'm going to have you stay just like that for a minute. His lungs are clear throughout both the anterior and posterior. No adventitious lung sounds are noted. So before, when we did the 99, I'm going to have you repeat 99 again, but as I listen with my stethoscope. And go ahead.
99.
And again.
99. 99. 99. 99. 99. 99. 99.
Perfect, and flip around towards me one more time. And we're going to do the same thing in the front.
99. 99. 99. 99.
Perfect, and I'm just going to take a listen up here as well, and you can just relax. Perfect. So the bronchophony was negative, and then one more time I'm going to have you flip to the left just so I can get to your backside, and we're going to be checking for CVA tenderness. So you tell me if this is tender. Any tenderness?
Nope. Nope.
Perfect. All right, and then we're going to move on to your heart. So we're going to start with the heart. I'm also going to listen to your carotid arteries. Perfect, and look to the left for me. Same thing on the right side. Perfect, and no bruit was noted. So then I'm just going to listen to your heart so you can breathe normally. normal S1 and S2 lung sound or heart sounds. And then my stethoscope is a master cardiology, so I only have a combo diaphragm and bell, so we only listen to it once. I'm then also going to look at your jugular vein distension, if you want to look left for me. So absence of jugular vein distension, perfect. And then I'm going to palpate for your point of maximum impulse. So that is mid-clavicular, and it's down the fifth intercostal space. And over, so. Perfect. And then we're going to move on. We'll have you lay down, and then we'll look at your abdomen. So we're going to move on to the abdomen now. First, we're going to inspect, then we're going to auscultate, percuss, and palpate, both light and deep. And then we're also going to be checking Rovsing's and psoas sign for appendicitis. So first, I'm going to inspect your abdomen, so I'm going to lift up your shirt. So just by inspection, I don't see any masses, no pulsating abdominal aorta. So then I'm going to take a listen. I'm going to start in the right lower quadrant here, and I'm just listening for vowel sounds. And listening for your aorta. And no bruits noted, and you have normal active vowel tones. So then I'm just going to percuss. You let me know if there's any tenderness. And we'll go top to bottom. And bottom to top for the liver. And then we're going to percuss for the spleen over here. No dullness is noted, and then he's tympanic throughout. And then I'm just going to lightly palpate your abdomen. You tell me if there's any tenderness.
Nope.
Nothing there. And so then I'm just going to palpate a little deeper. And any tenderness there. Perfect, and no masses were noted. I'm also going to feel around for your kidneys. Not palpable, and we'll go over here to your left side. And no palpable kidneys, and then I'm going to feel for your liver. Liver is not palpable, which is normal, and then I'm going to come over here and feel for your spleen. And I'm going to do that one more time. You take a big deep breath in for me, and let it out. Perfect. And then we're going to do Rovsing's. So what I'm going to do is I'm going to press down over here on your left side, and then I'm going to release it slowly, and I just want you to let me know if there's any pain. Anything there? And what about now? Perfect. And then I want you to straighten this leg for me, and we're going to check psoas sign, and I'm going to just provide resistance on this right leg, and I want you to push up against it. Perfect. Any tenderness? Excellent. So then he's negative for appendicitis. So next we're going to move on with the musculoskeletal assessment, starting with the lower half. So what I'm going to do is I'm going to inspect and palpate your joints and muscles, starting from your hips all the way down to your toes. So we're going to start up here at your hips, and we're looking for your greater trochanter. Here, any tenderness?
No.
And then we're going to come down this way down to your hamstrings, any tenderness there?
No.
And we're going to look at your knees and look at your patella. Patella on this side. And we're going to come down towards your feet. And I'm going to look at the joints on your toes. Any pain or tenderness?
No.
Perfect. And then we're going to do range of motion. So I'm going to assist you here, starting with your right leg. I'm going to bend it up towards you and out and back in. And then I'm going to straighten it out. Same thing with this left leg. Up towards you and out and in. And we're going to straighten it out. And then I want you to move both legs one at a time out and then back in. Perfect. And we're going to take one more look at your knees. I want you to bend and extend. And same thing with this left side. Excellent. And then we're going to come down here towards your feet. I want you to press down on my hands like a gas pedal and pull your toes to your nose. Excellent. And then I want you to roll your feet out and then back in. And then curl and extend your toes. Perfect. And then I'm just going to feel your pulses. And through your pulses up towards your knees here. Excellent. So pulses are 2+. He's got full range of motion, no tenderness, and 5 out of 5 strength. So now I'm going to have you sit up, and we're going to do the musculoskeletal assessment and range of motion for your upper half. Okay, so we're going to start your musculoskeletal assessment for your upper half here. I'm going to be feeling along the joints and the muscles of your shoulders and kind of working my way down towards your fingertips. So we're going to start up here with your trapezius muscles. Any pain or tenderness?
No.
And we're going to look at your shoulder joint, your biceps and your triceps. And I'm going to have you straighten your arm there. Your epicondyles. Down your forearms there. To your wrists. And to your hands. Perfect. And then we're going to come over here to the other side. And same thing with the shoulder joint. And your clavicles. And then we've got your biceps and your triceps. And again, working our way towards the epicondyles. Down your forearm here. Your wrists and your joints. And then I'm going to just borrow both your hands here. We're going to feel your pulses. Great, 2+. Perfect. And then can you make a fist and spread your fingers? Excellent. So now we're going to be testing range of motion. So first we're going to check your shoulders. I want you to put your hands out in front of you and then up above your head and back down at your sides. And then I want you with your left arm to come up above your head and back down. And same thing on the other side. Perfect. And then I want you to reach back behind your back with your shoulder just like this, fingertip to fingertip. And the opposite. Perfect. And then I want you to straighten your elbows here and bend them up back towards you and straighten them again. And then I want you to turn them in and then out. Perfect. The same thing with your wrists. I want you to bend them towards you. Up and then back down. Perfect. Okay, so we're going to do this same thing with range of motion, but we're going to do it with resistance so we can check your strength. So I'm going to have you put this arm out in front of you. And I want you to lift it towards you, but I'm going to provide resistance up above your head and back down. Perfect. And then I'm going to have you put it out at your side and up towards your head and back down. Perfect. And then keep it here, and you're going to come in towards you and out towards your back. Perfect. And then we're going to come over on this side, and we're going to be doing the same thing. So up towards your head and back down Perfect. And out towards your side, up towards your head, and back down. Excellent. And then in towards you, and out towards your back. Perfect. And then both arms, or actually we'll do this arm out in front of you. And then you're going to bend it at your elbows. Again, I'm going to be providing resistance. So towards you and push out towards me. And we're going to do the same thing on this side. So in towards you and out towards me. Perfect. And then we're going to, if you put both of your, there you go, hands out in front of you, you're going to pull me towards you. I'm going to provide resistance and then push me back. Perfect. So now that we've done push-pulls, I'm just going to grab your hands one more time and give my hands a big squeeze. Perfect. And then make a fist and release it and then spread out your fingers. Perfect. So on his upper body, he's got 5 out of 5 normal and expected strength with resistance. And then I want you to take each of your fingers and touch it towards your thumb. Excellent. So now we'll have you lay down and we will do the same thing on your hips and your knees. We're going to check the strength on your hips and your knees. So what I'm going to do is I'm going to have you bend your knee towards you with resistance and straighten it with resistance. Perfect. And same thing on this side, towards you and straighten it with resistance. So we're going to bend this knee and I want you to bring it out towards me and back in and straighten it. And then I want you to fan it out towards me and back in. Perfect. Same thing on this side. We're going to bend this knee, bring it towards you and out. Perfect. And then straighten it. And then you're going to fan it out and back in. Perfect. So on his lowers, he's got 5 out of 5 normal and expected strength. So then we're going to move on to the sensory exam, so I'll have you sit up again. Okay, so I'm going to be checking your sensation in your upper and your lower body. So I just want you to close your eyes and I'm going to touch different parts of your arms and hands to start off with, and I just want you to tell me where I'm touching. So go ahead and close your eyes for me.
Left forearm, right bicep, left forearm, right forearm, left thumb, left bicep.
And then I'm just going to hold your hand for you, and I want you to tell me if I'm moving your fingers up or down.
Up, up, down,
And same thing on this other hand.
up, down, up.
Perfect. And then I want you to keep your eyes closed, and I'm going to set something in your hand, and I want you to tell me what it is.
Feels like a pen.
Perfect. And I'm going to take this one from you, and we're going to do another one on your right hand.
A key.
Excellent. And then we're going to move on to your lower legs. Okay, so same thing with your lower legs. Keep your eyes closed, and I'm going to touch your legs and feet, and I want you to tell me where I'm touching.
Left shin, right knee, right ankle, left toe.
Perfect. And same thing as I did with your hands, I'm going to borrow your feet, and I want you to tell me if I'm moving your toes up or down.
Up, up, down,
And then we're going to do your right foot here.
up, down, up.
Perfect. And then we're going to move back to your upper half, and we're going to be checking your reflexes. Okay, so now we're going to be checking your deep tendon reflexes on both your left and your right side, and both your tricep and your bicep. So we're going to start here in your right bicep, and we just want you to relax your arm by your side and just let it dangle. And I'm just going to be looking for your tendon there, and just relax. Perfect. And then we're going to come up here for your tricep. Okay, and I want you just to let this dangle on your side. Perfect. And just let your arm dangle. Perfect. And now we're going to come up here and we're going to do your tricep. And just let your arm dangle at your side. Excellent. The other thing I want to do is I want you to put your hands on your top of your knees, and I want you just to back and forth. Perfect. And then I want you to put your right arm out and touch it to your nose, your finger to your nose, and out and to your nose, and same thing with the other side. Perfect. And then I'm going to check your deep tendon reflexes on both your Achilles and your patellas on your knees. And just relax your legs. And we'll come over here to this side. Perfect. And then we'll do your Achilles. All right, so now we're going to be doing your Achilles reflex on your right foot. So I'm going to push your toes up, and I just want you to relax your foot. There you go. And I'm just going to hit the back of your Achilles tendon here. Perfect. And we're going to do the same thing on this side. So again, I'm going to lift up your toes there. Perfect. Okay, so while I'm down here, I'm also going to have you take the heel of this foot, and I want you to drag it down this shin. Perfect. And same thing on the other side. Excellent. Now I'm going to have you stand up, and we're going to check your gait. So I want you to first just walk towards me. Perfect. And if you want to go back to your starting point there. And now I want you to walk on your heels towards me. Great. And then back towards the couch again. And then I want you to walk on your toes towards me. Excellent. And then last thing, if you want to head back towards the couch. Now I want you to walk on an imaginary line heel to toe towards me. Perfect. Now what we'll do is we're going to look at your spine. Okay, so now I'm going to look at your spine. Well, first we'll look at your shoulders here. They're level. Now I'm going to have you turn around. So shoulders are level. I'm going to feel down towards your spine. Perfect. It's straight. I don't feel any scoliosis. He's standing up straight and tall. There's no kyphosis. And then if you want to turn back towards me. So this is going to check your balance. I want you to close your eyes and put your arms out in front of you. And I'm going to be right here in case you sway. Perfect. All right, I think we're finished with your wellness exam. Thanks for coming in.